Welcome to this lesson. This presentation was developed by Haley Cash. This module will teach them population-based data sources. Slide 2. These are our learning objectives. Focus on population-based resources, review the different types. Review passive versus active surveillance. Common strengths and limitations. Reasons for bias. Slide 3. We can remember types of surveillance. Institution-based is data generated through administrative and operational activities, not confined to health sector. Population-based is data generated from sources that relate to the whole population. Slide 4. Are the hospital data representative of the entire population? Data cannot represent the population and relevant subpopulations. We would have assumptions from Big Island to other islands. Slide 5. Are these NCD screening data representative of the entire population? NCD screening is a population-based source of information depends on coverage and continuity of activities. Slide 6. Surveillance TWG recommendations followed those from WHO discussion papers but went beyond these recommendations to focus on youth. School surveys for NCD risk factor surveillance are attractive because they are cheap and easy to do, compared with house-to-house surveys. Youth risk factors are also leading indicators for NCD trends. If we focus on youth, it will be useful for promoting painful policy changes. Youth are more vulnerable for tobacco, alcohol abuse, or obesity, overweight. Slide 7. You can look population and institution-based health information data sources. Population-based are censuses, civil registration, and population surveys. Institution-based are individual, service, and resource records. We are going to review population-based health information data sources. Slide 8. Our first population-based source of information is the censuses. Censuses is a primary information source for determining the size of a population and its geographical distribution, plus the social, demographic, and economic characteristics of its people. Census must ideally do every 10 years. Slide 9. Which are the strengths of the censuses? Censuses allows for national and local planning, estimating population sizes and trends. Major determinants and risk factors, as poverty, sanitary facilities, and water supply, may be included. It allows for small area estimation and stratification. There's a lot of data. Censuses can also provide information on health and mortality, births and child mortality, and crude mortality. Slide 10. Which are the limitations of the censuses? Censuses has often limited amount of health data. Censuses is implemented rather infrequently. It is timely and expensive. Slide 11. Civil registration is part of vital statistics system. It is a continuous, permanent, compulsory and universal recording of the occurrence and characteristics of vital events. Civil registration includes live births, deaths, fetal deaths, marriages and divorces, etc. Civil registration has been provided by decree or regulation, in accordance with the legal requirements. Slide 12. Which are the strengths of civil registration? Civil registration is the most effective source of vital statistics. It ensures universal and continuous registration which enables the routine production of vital statistics. Civil registration is key input for policymaking and planning and human development. It is invaluable for assessing and monitoring the health status of populations, and planning interventions. Slide 13. Civil registration has limitations. It requires the accurate and continuous registration of population vital events from birth to death. Civil registration must be recorded when population events occur. It requires strict national standards. Slide 14. Population surveys is other population-based source of information. WHO has developed STEPS, JITS, GATS and GSHS. The STEPS approach focuses on obtaining core data on the established risk factors that determine the major disease burden. It is sufficiently flexible to allow each country to expand on the core variables and risk factors, and to incorporate optional modules related to local or regional interests. The Global Youth Tobacco Survey, GYTS, is a school-based survey designed to enhance the capacity of countries to monitor tobacco use among youth and to guide the implementation and evaluation of tobacco prevention and control programs. The Global Adult Tobacco Survey, GATS, enables countries to collect data on adult tobacco use and key tobacco control measures. The Global School-Based Student Health Survey, GSHS, is a collaborative surveillance project designed to help countries measure and assess the behavioral risk factors and protective factors in 10 key areas among young people aged 13 to 17 years. CDC has BRFSS and IRBS. Some countries has developed school health surveys. Slide 15. The principal strength is to have population-level data. It can include a wide range of health-related variables. Questions can be customized and made culturally relevant. Slide 16. Which are the limitations of population surveys? Surveys need to include a representative sample. Population surveys often rely on census data for sampling. Data needs to be accurate. Data must have reliability and validity. Survey should be considered and controlled for bias. Surveys must be carried out with efficacy, well-designed, planned, and carried out. Slide 17. Do you know difference between population and sample? Population is the group of people you're trying to represent with your data. Sample is the portion of the population that is used as a representative. Slide 18. Accuracy is the degree to which a measurement or an estimate based on measurements represents the true value of what is being measured. It depends on reliability, precision, of an observation and validity of an observation. Slide 19. Reliability answers the question, can the same results obtained be replicated if the test is repeated? Slide 20. Validity is the extent to which a measurement, test, or study measures what it purports to measure. It is the ability of a test to distinguish between those who have a disease and those who do not.